Welcome to my YouTube channel Voxo Health and Pharma. If you are new in my YouTube channel, please subscribe my channel and press the bell icon. Today I will discuss about diabetes mellitus. The topic of discuss about diabetes mellitus. What is diabetes mellitus? Global impact of diabetes. Types of diabetes mellitus. Causes of diabetes mellitus. Signs and symptoms of diabetes mellitus. Pathogenesis. Diagnosis. Clinical presentation. Treatment of diabetes mellitus. This video divided into two parts. The second part of videos link give in I button or in description. Please must watch this video for more information. I request you, if you like our video, please subscribe our channel, and press the bell icon to get new video related pharmacy or health. In this part we will discuss about what is diabetes mellitus, causes of diabetes mellitus, global impact of diabetes, types of diabetes mellitus, signs and symptoms. Let's start the video. First, what is diabetes mellitus? A chronic disease which is either caused due to the production of insulin in insufficient amounts or due to the inefficiency of the insulin produced is termed diabetes mellitus. As a result of deficient amounts of insulin, glucose concentration in the blood increases, thus damaging several organs of the body, more specifically the nerves and blood vessels. It is the most common form and is mostly referred to as diabetes. Diabetes mellitus is a disease that prevents your body from properly using the energy from the food you eat. Diabetes occurs in one of the following situations. The pancreas, an organ behind your stomach, produces little insulin or no insulin at all. Insulin is a naturally occurring hormone, produced by the beta cells of the pancreas, which helps the body use sugar for energy. The pancreas makes insulin, but the insulin made doesn't work as it should. This condition is called insulin resistance. To better understand diabetes, it helps to know more about how the body uses food for energy, a process called metabolism. Your body is made up of millions of cells. To make energy, the cells need food in a very simple form. When you eat or drink, much of your food is broken down into a simple sugar called glucose. Glucose provides the energy your body needs for daily activities. The blood vessels and blood are the highways that transport sugar from where it is either taken in the stomach, or manufactured in the liver, to the cells where it is used, muscles, or where it is stored, fat. Sugar isn't able to go into the cells by itself. The pancreas releases insulin into the blood, which serves as the helper, or the key, that lets sugar into the cells for use as energy. When sugar leaves the bloodstream and enters the cells, the blood sugar level is lowered. Without insulin, or the key, sugar can't get into the body's cells for use as energy. This causes sugar to rise. Too much sugar in the blood is called hyperglycemia, or high blood sugar. Next. Second. Global impact of diabetes. According to the World Health Organization, WHO, the International Diabetes Federation, IDF, and other health-related organizations, diabetes is increasing at epidemic levels in the United States and around the world. In 2017, 425 million people worldwide had diabetes, up from an estimated 382 million in 2013 and 108 million in 1980. The world population of diabetes increased from 4.7% in 1980 to almost double to 8.8% in 2017, leading India, China and the United States. By the year 2030, the number of people suffering from diabetes is expected to increase from at least 680 to 790 million. About 90 to 95% of the diabetic population is type 2 and 5 to 10% is type 1. As shown in this data, the top 5 countries with the most population of people with diabetes are China, India, United States of America, Russia, Africa. Over the past decade, diabetes prevalence has risen faster in low and middle income countries than in high income countries. Diabetes caused 1.5 million deaths in 2012. Higher than optimal blood glucose caused an additional 2.2 million deaths by increasing the risks of cardiovascular and other diseases. Next. Third. Types of diabetes mellitus. Diabetes mellitus can be classified based on the clinical stages and the etiological types as follow. First, according to the clinical stages. Second, according to etiology. First, according to the clinical stages. Based on the clinical stages, diabetes mellitus can be classified into three parts. 1. Insulin requiring for survival. This corresponds to the former clinical class of insulin-dependent diabetes mellitus. 2. Insulin requiring for control. This class is characterized by the requirement of insulin for metabolic control rather than for survival. 3. Non-insulin requiring. This class includes those diabetic patients in whom diabetes can be controlled satisfactorily using non-pharmacological methods or drugs without the use of insulin. The latter two types correspond to the former class of non-insulin dependent diabetes mellitus. 2. According to etiology. Based on the etiology. Diabetes mellitus can be classified into three parts. First, type 1 diabetes mellitus. This type is characterized by destruction of beta cells, insulin to as producing cells, and thus insulin is required for survival. This type was referred to as insulin-dependent diabetes and can be further classified into two parts. First, type 1 immune-mediated diabetes mellitus. In this type, autoimmune destruction of beta cells occurs. Other terms for this type of diabetes mellitus: insulin-dependent diabetes or juvenile onset diabetes, since it may begin during childhood. 2. Type 1 idiopathic diabetes mellitus. This type is not related to autoimmunity and the beta cell destruction is due to unknown causes. Second part, type 2 diabetes mellitus. This type is characterized by disorders of insulin action and secretion. Patients have relative insulin deficiency, in contrast to absolute insulin deficiency in type 1 diabetes. It is also known as adult-onset diabetes and was earlier referred to as non-insulin-dependent diabetes, though the term is obsolete now. Third part. Other types. This includes those in which the underlying defect or disease process can be identified in a relatively specific manner. Example: fibrocalculus. Pancreatopathy. Next. Causes of diabetes mellitus. The causes of diabetes are not known. The following risk factors may increase your chance of getting diabetes. Family history of diabetes or a personal history of gestational diabetes. African American, Hispanic, Native American, or Asian American race, Pacific Islander or ethnic background. Injury to the pancreas, such as infection, tumor, surgery or accident. Autoimmune disease. Age risk increases with age. Physical stress, such as surgery or illness. There are risk factors that you might have more control over, including high blood pressure, abnormal blood cholesterol or triglyceride levels, smoking, being overweight, use of certain medications, including steroids. It is important to note that sugar itself doesn't cause diabetes. Eating a lot of sugar can lead to tooth decay, but it doesn't cause diabetes. Next. Signs and symptoms. The symptoms of diabetes include increased thirst, increased hunger, especially after eating, dry mouth, frequent urination, unexplained weight loss, even though you are eating and feel hungry. Other symptoms include weak, tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing sores or cuts, dry and itchy skin, frequent yeast infections or urinary tract infections. Must watch part 2, link give in description on. In bottom. In the second part we will discuss about pathogenesis of diabetes mellitus, diagnosis, clinical presentation, or treatment of diabetes mellitus. Please subscribe my channel. Thank you for watching this video.